This is an example of a database that might list different products and services. And the patient would access this database through his insurer's website. And the insurer's website would act as a filter. And I'll get to that in a minute. In the first column, there's a listing of drugs that might be prescribed to a patient who had atrial fibrillation, for example. It's a rapid irregular heartbeat. And in the second column, it shows the different pharmacies that are within a certain radius of where he lives. In the third column, we have the co-pays versus cash back. And it's listed in the order of least expensive drug first, in an effort to promote thrift. You'll notice that the first drug, digoxin, offers a cashback bonus of, say, $53. And these are just numbers I picked out of the air. Well, what that means is that the patient would receive a cashback bonus of $53 if he chose that drug versus an expensive drug like amiodarone at the bottom. Amiodarone would cost him $28 copay if he chose that one instead. Now, these cashback bonuses or co-payments would be determined by their insurer. So it would be necessary for the patient to access this database through their insurer's website, where these cashback bonuses and co-payments could be added to the database. Different insurers would have different co-payment schedules, cashback schedules, depending on the quality of their plan. Another column, the distance from that patient's home. For example, from the Food and Drug Administration, it would give any appropriate information that the consumer might be looking for, what the drug is used for, the incidence of side effects, et cetera, et cetera. And last would be customer feedback, and it would give the percentage of customers that offered positive feedback versus negative feedback, very much the way it's done on eBay. Now, these would be links, and if you clicked on that link, you would go to a listing of the different comments that people had posted, and you could see who was unhappy with the drug and why. Now, this database could be used not just for drugs in this example, but it could be used for procedures, for surgeons, for where the first column might be, say, surgeries, and the second column would be surgeons in that area that offer that. And by clicking on them, you would go to that surgeon's website, for example, and it would tell you all the wonderful things about that surgeon. If you clicked on the procedure, it would give you a description. The co-pays and the cashbacks would be similar, distance, and there would be third-party information about, say, the quality of that particular surgeon, his complication rate, his credentials, et cetera, and customer feedback again. So this could be used for any type of product or service, and the customer would have access to it, the patient would have access to it through their insurer's website. Now, let me give you 3 examples of how this might work. Let's say a patient who had atrial fibrillation went to see his doctor, and the doctor said, well, there's several different drugs that you could try. I can think of 4. Are you interested at all in saving money? And if this particular patient might say, no, I don't feel comfortable making that choice. I don't want to make that choice. Just give me what you prefer. I'm going to go to the pharmacy that I always go to, and we're going to do it that way. Yeah, that's fine. Okay. And he would prescribe amiodarone, because amiodarone is probably the most effective drug. He would go to the pharmacy that was closest to his house, and he would pay the copay, whatever it was, and if that's the way he chose to shop, that would be his right. Another patient would go to see that same doctor with the same condition, and the doctor would say the same thing. Basically, you have atrial fibrillation, we need to prescribe a drug to keep your heart rate from going too fast. There are 4 drugs that would be safe for you to try. Are you interested in saving money? And this particular patient might say, well, yeah, I'm laid off, I don't have a lot of money, saving money is important to me. And the doctor would say, well, these are the 4 drugs that I would prescribe: amiodarone, diltiazem, metoprolol, or digoxin. You can decide which one you want to choose. I think any of the 4 would probably work pretty well for you. You can go out, my secretary will show you how to get on the website, and you can make your choice. So that patient would go, get on the website through his insurer's homepage, would see that digoxin would pay $53 cash back rather than $28 copay, so that's the difference of what, 70, 80 bucks. If he looked at the information and saw that most people were happy and he was happy with what the FDA had to say about it, he would choose digoxin and pocket the $53 or some way receive that cash back, and he would be, it would be his choice and he would be happy. A third patient might come in with the very same conditions. The doctor would tell him the same thing, that there's 4 drugs that he could try. All of them would probably be effective. And he might ask the doctor, well, doc, listen, I'd like to save money, but I don't feel comfortable making this decision all by myself. Can you recommend something? The doctor might say, because he gets a couple of bucks cash back too, well, I think metoprolol would be a good choice for you. I think it would do a good job for you, and people have good satisfaction with it, and I think you could save a little money from your insurance company. And the patient might go find the least expensive pharmacy and choose it that way. These are just examples of how this might work. It wouldn't work in every case, but in most cases, or at least a lot of cases, I think patients would choose to find the best value in healthcare that they could find, because the incentive would be there for them to do that. These changes would allow patients to control their own healthcare decisions safely within parameters set by their physician. Patients would have a financial incentive to choose their healthcare options thriftily. Taken together, these conditions would produce buying behavior approaching that of normal consumers in other markets. Normal buying behavior would in turn produce price competition in the market, allowing the market to function correctly. As suppliers' demand curves became more horizontal, it would become advantageous for them to offer lower prices in order to attract more business. Prices would be driven downward through the effect of price competition in the market. And this is what we're looking for in order to correct the healthcare crisis.